is Dr. Vinod Kumar, Arora, sir. He will speak on the small pupil, big problem. We had a last time media conference at Dehradun,
And
and
we'll
Dr.
request the speaker to be on time.
Vinod sir was the mastermind of last year media conference, and he made it very much successful.
Thank you very much. And good afternoon all. So small may be beautiful, but sometimes you got a big problem because of the small people. So what is a small pupil? It depends from surgeon to surgeon. For some it's 2 millimeter, 3 millimeter, 4 millimeter. Depends, is the surgeon skill and technique. Some person can do very easily from 4 millimeter, experienced surgeons, but not all. Then again the intraoperative situations, properties of the iris, tissue and pupil. So you have to look your competence and can plan to do without doing anything, or you can just take the means to dilate the pupil. So I think there will be a lot of repetition also because the topic has been covered already. So pharmacological agents like topicamide, cyclopentolate, NSAIDs can be used to dilate the pupil. If it's not dilating properly, you can take the help of viscomidiasis, Helon, soft shell technique, discovis. But the only problem is most of the time visco keep on coming out and you have to put it again. Then pupil stretching, that is elastic pupil or rigid pupil. Don't do in rigid pupil. I'll just come to that point. Then spectropy, low fluidics parameters, use chopper in these cases, and restrict manipulation to the pupillary center. Bimanual IE is preferred in these cases. So what are the problems we get with non-dilating pupil or poorly dilating people? There's a reduced surgical space, small, so you have to make them a small capsular axis. There's less visibility of the peripheral lens. There is chances of iris prolapse, retained cortical matter in the peripheral capsule bag may be there. You can't see it from there. One haptic, the oil may be in the capsular bag, other may be in the sulcus. Then increased post-operative inflammation, corneal edema, and increased chances of macular edema will be there. So what to do if you get a small pupil? There are many means. There are many ways you can skin the cat. Any eye was first thing you have to be prepared. Any eye can have IFS, you can't know it previously. Reduced threshold for using pupil expansion devices, release posterior synechia and peripapillary memories completely. Intracameral injection of the combination of mediatics and local anesthetics are used. Then test and distinguish the elastic from non-elastic rigid pupil. Unlike non-elastic myotic pupil, the IFI's pupil immediately snaps back to the original size following attempts to stretch it. So you can differentiate between the rigid and non-rigid pupil. So what are the things like iris hooks? These are first thing we started using it. And for the beginners, iris hook is a much easier technique than going to the other pupillary devices. So for the tips of using iris hook is, it's a 0.5 millimeter, make 0.5 millimeter incision. It's better to put a mark. Sometimes you make a corneal incision, you forget where the incision was there. So for the beginners especially, you put a mark there. And then you just place the incision there. A hook should be planned well in advance if it is to be placed at the phaco incision. And your incision should be the limbus, not the corneal in these cases. First you have to retract the stopper, then place iris hook in there. Hold the stopper and then you can manipulate also with that one. Then utilize the tinted portion. Suppose you have placed one, you can utilize that tinted portion of the iris to place the second one. Over retraction and asymptotic retraction of the hooks to be avoided. Don't stretch it too much. When used after a rhexis, use a second instrument. So that will avoid your hook into the capsule margin. In deep set eyes, you have to be careful. You can cut the edges because if you put in a deep set eyes, you may find it difficult to do surgery. So you can cut the edges which are outside, and removal will be much easier also. These are the pupillary expanding devices. I will cover some of them. It's a ASIA pupil expander. It's coming in a big way, and they are soon going to be marketed in India also. There's no intraocular manipulation, fast, easy, and safe positioning and removal. Efficient iris expansion. Minimum incision size should be 1.1 millimeter for putting these things. These are made from nylon, just to show how it can be used. So it's the animation for that thing. It's very, very tiny. And there are special forceps you have to hold with them. These are reusable forceps. So the advantage here is you don't have to put anything, second instrument inside the eye. You're just directly putting your expansion device only.
I think, Dr. Vinod, please go fast forward, I think.
Yeah, sure. So these are again, this is a demo of eye ring pupillary expander. So this is very easy to put, only thing it's a little bulky. It's a rig material made of polyurethane. It's a fixed channel, side does not compress and pinch during the insertion of removal. There is a complete 360 engages iris and eliminated distinct stress points. So it's an all-round stretch on the pupillary margin. And you get a very wide 6.3 millimeter circular area. This is the manual ring, very popular internationally. It's a 2.2 millimeter in season. It's a gentle expansion and points of contact. We have to use high viscosity. The ring is a very classic one. You can use oscillator or manual ring. Just a small demo. I think we're running out of time, but very easy to put and takes very minimal size and easy to insert also. You got an injector and extractor also with this one. Then this is the most probably in Indian context and getting popularity in the world also. So B-Hex popular expander is a third generation Bhattacharjee ring, a flexible jointless hexagonal polymer ring, thin with 6.50 and 0.7 millimeter profile, 5.5 millimeter expansion you get. Now we got a newer variant for the rigid pupil. And this is the last one. And besides, we have other also. Gupta ring is also there, which is a little thicker and difficult to take it out. So we got a lot of devices. Depending on your competency, I think for the beginner, you start with the iris hook, then gradually switch over to thing. Only thing you have to use a good viscoelastic while using these instruments. Thank you so much.
Thank you, Dr. Vinod Arora.